Medical Intuitive Insights with your host, Dr. Gloria Warren, is a program that presents topics on medical intuition, holistic opportunities outside of mainstream society, and scientific research as applied today. Topics range from online intuitive readings to interviews unveiling alternative healing modalities and discussing them with inspirational leaders. Dr. Warren is the bridge within holistic arts while stressing the balance between the spiritual and physical self. So now, please welcome the host of Medical Intuitive Insights, Dr. Gloria Warren.
Why can't I breathe? What triggers asthma? And can asthma improve? So let me just welcome to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren. We do have Nurse Peggy here with us today, which I'm very grateful, of course, as always. And we are going to discuss the causes, the symptoms, and the solutions to asthma today. So let's first get into what is asthma. Okay, the technical definition is that asthma is a chronic inflammatory disease of the airways in which the breathing tubes, the bronchi, become swollen, oversensitive, and narrowed, making it difficult for air to move freely in and out of the lungs. While asthma cannot be currently be cured, it can usually be controlled effectively through proper medical treatment. Trigger avoidance and healthy lifestyle practices. We're going to discuss these things here today, by the way. So maybe we can help you with some ideas and maybe ideas to take back to your medical professional to discuss. So, chronic inflammatory airway disease. Unlike asthma, the a temporary respiratory infection, asthma itself involves ongoing inflammation of the bronchial tubes. Even when symptoms aren't present, there could be inflammation. This chronic inflammation causes the airways to become more reactive, meaning they respond excessively to allergens, infections, exercise and cold air, smoke, or even environmental triggers. Over time, repeated inflammation can contribute to structural changes in the airway known as airway remodeling. Yeah, that sounds a little scary. Let's welcome our guest, Peggy, to our show, Nurse Peggy. How are you, Peggy?
Oh, just wonderful. Thank you for having me today.
Yeah.
And the universe has a funny way of connecting us here on certain days. Little self-disclosure, I spent yesterday most of my day in the emergency room getting my asthma treated. So,
Mm-hmm.
but
So,
I've had it ever since I was a child. There is a genetic component many times, but there's a lot of environmental triggers that make people with the genetic propensity to have it that make it worse. And there's also people that didn't have it, but they work in environments that can trigger the same kind of inflammation. So
right.
maybe I can learn something here today too, because going to the ER wasn't the most fun experience I've had in recent weeks.
Well, perhaps we can all learn some added tips with this information today. I know I have allergy-induced asthma, so I carry everything you need. Usually what you need, and mine's pretty much under control. And when you told me you were in the ER, and you said, "So what's our topic today?" and I said, "Asthma." We really need to do this topic. It's that time of year. A lot of people, when summer comes around, uh, the pollens are in the air, not just pollens, the chemicals and all the rain, and just so much is in the air, especially nowadays with those other particulate matters, pollution, they call it, I believe. Yeah, so this is just right timing. So I'm going to mention a few things about the normal breathing and how it works. So air enters through the nose and mouth, travels down the trachea here, and progressively into smaller bronchial tubes, and finally reaches millions of tiny air sacs called alveoli. Here, oxygen, they're microscopic size, they're very tiny. Here, oxygen passes into the bloodstream inside your lungs. That's in the lining of your lungs. So the oxygen goes into the bloodstream while the carbon dioxide leaves the blood when you exhale. To be exhaled, I should say. Healthy airways remain open and flexible, allowing air to move freely with very little resistance. But what occurs in an asthma attack, I'm sure Peggy knows very well, and I've been experiencing it in the past. But during an asthma attack, three major events occur simultaneously. The airway lining becomes inflamed and swollen. The muscles surrounding the bronchial tubes, you get bronchospasms. The thick mucus, I'm sure you know what that means, is produced further, narrowing the airway. Together, these changes greatly reduce the total airflow, producing symptoms such as wheezing, coughing, chest tightness, shortness of breath. Most asthma attacks are reversible with prompt treatment, but severe asthma attacks can become life-threatening and even fatal. So why inflammation matters? This is my pet peeve in life is inflammation. As we get older, we get more and more of it, actually, inflammation in our bodies. Well, with asthma, inflammation is the driving force. Specialized immune cells, including eosinophils, mast cells, T lymphocytes, and other inflammatory mediators, release chemicals that cause swelling, mucus, and tightening of the airway muscle. Persistent inflammation also makes airway hyperresponsive, meaning even small exposures to triggers can provoke significant breathing difficulties. Controlling inflammation is therefore the primary goal of long-term asthma treatment.
Well, Gloria,
So
if I
who did
could interfere,
right ahead?
done a great job talking about the physiological causes. But
Mhm.
the other side of that, coming from the holistic nurse, of course, is stress is one of the biggest. Um, and
Yeah.
stress is the biggest cause of cancer. It's the biggest cause of triggering almost all the autoimmune disorders. I had, as a baby, when I was adopted, I learned, I was an older child adopted, but my medical record showed I had been hospitalized with croup many times as a baby. Um, I I just kind of assumed, growing up as a kid in college, that must have been like the precursor to asthma. Learned since, yeah, I was surprised to see that babies are still getting croup now. It is a different infection process and inflammation thing. But what I'd also have seen many times, well, I was actually controlled until I went to college. Then I was living in a dorm room. It was like a 10 by 6 room with four roommates, two sets of bunk beds. Our mattresses were made of kapok. It was in northern Alabama, a very rural farm country area. And all of us had 50 stuffed animals on our bed. Plus, I had a couple parakeets in that room too. So those were definitely the triggers, all of them. And that didn't seem to be a stressful time. Stress
In a compacted room,
it was
amplifying all those triggers and them
that
while they were
time
expanding.
that I actually had to go undergo any allergy testing. And
Right.
at that time did start giving myself allergy injections and everything. But like most kids, you don't take things seriously at that age. You're not at home where somebody's telling you to do it. I didn't follow through with all that. But a lot of people that live here on the East Coast in the industrial cities, they retire Arizona and places like that have dry air and a different kind of climate. So you can
Mhm.
actually, if you're fortunate to move in those ideal weather for whatever your medical problem is, you can pick your climate and have less issues. Uh, we've said before, cardiac people shouldn't be shoveling snow. Well, neither should people with breathing. And parents don't realize if you have a child that might be predisposed to this secondhand smoke, including the secondhand smoke from the medical smoking products. That still affects the people around you who are sensitive. But stress and hydration, I think, are one of the easiest ways to keep this under control.
Yeah. And asthma is just one of those conditions that are caused from all those things in the air around us. So keep that in mind. There's other things as well, particularly even epilepsy can be triggered from what's in the air around you as well, because your brain gets less oxygen with more particulate matter in the air. So asthma works the same way in a sense. The more particulate matter in the air, actually can trigger an asthma attack. And it's not, um, it affects everybody. It can affect anybody, every age, race, background, social, economic background as well. So risk factors do include family history of asthma or allergies. So it's common that if somebody like your parents have it, you may acquire it. It all depends. Personal history of eczema or allergic rhinitis. Because your body super reacts to things, you may have a higher chance or to get asthma. Environment allergen exposure, and you're the perfect poster child for that one, Peggy. Air pollution, tobacco smoke, occupational chemical exposure. That's more common than people realize. Many people, even engineers, they deal with so many chemicals in their environment at work. And this is a big concern of mine because I know quite a few stationary engineers in my family. So respiratory infections during childhood can produce a weakening in the respiratory tract. Obesity. You only can take in, your lungs can only take in so much oxygen. The heavier you are, it dilutes that oxygen throughout your body, and you maybe have a harder time breathing. Certain genetic predispositions, although asthma commonly begins during childhood, many individuals develop asthma during adulthood. I was one of those people, but it's allergy induced, like I said. So childhood versus adult onset asthma. So childhood asthma usually is developed before the age of 12, also often associated with allergies and eczema. I did notice too that with watching people in the medical field, I noticed that when their lungs were smaller than their body was growing at a faster rate, nothing grows evenly in a human body when you're a child. I think that may be something else to consider. Boys are slightly more likely than girls to develop asthma before puberty. Some children experience improvement as they reach adulthood, although some symptoms may return later on in life. So adult onset frequently begins after 20. That's what they consider as adult onset. More common among women than men. See, it's reverse. Boys in childhood asthma and women in adult asthma. Um, Less likely to resolve spontaneously, though, and often associated with workplace exposure, hormonal changes, just like we were talking about, even respiratory infections. If you've had several respiratory infections, you may develop asthma. Chronic sinus disease is one also that many people end up getting asthma. It may be more persistent and require long-term management too as an adult. As an epidemiologist, I need to mention the statistics. You know that, right, Peggy? Um, so, according to the latest national surveillance data, approximately 25 million Americans are currently living with asthma. 25 million. About 8.6% of U.S. adults have asthma. Approximately 6.5% of U.S. children have asthma. Asthma accounts for millions of physician visits annually. Millions. More than 3,500 Americans die every year from asthma-related complications, despite the condition often being highly manageable with appropriate treatment. Sometimes you forget your inhaler, or maybe it's a nice day and you think, oh, I'm not going to need it, but then when you're out, guess what? Maybe a little late. Always remember to carry your medications with you. So, and globally, asthma remains one of the world's most common chronic respiratory diseases, especially with the pollution increasing in our world. So, approximately 363 million people were living with asthma in 2023. Asthma causes approximately 422 deaths worldwide. 422,000 deaths worldwide. I am so sorry.
Well, why don't we take a brief break here, Gloria, and we
Thank
come
you.
back. I'll talk about some of the good ways to monitor this at home and keep track of things.
Thank you very much. Okay.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a 6-time national placer, including 2 seconds, 2 thirds, and 2 fourths. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorick, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorick has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Welcome back to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren. And today we are talking about asthma, the symptoms, what to expect, medications, even everything. This is a one-stop shop for asthma. And between this and your medical provider, we hope that we can help you today. We have Nurse Peggy here with us today. So let's just mention some of the things that happen inside the airway, like chronic inflammation, airway swelling, smooth muscle contraction, excessive mucus production, narrowing of airways. Do these sound familiar to you, Peggy?
They do, and even though I've grown up with this and lived with this all my life, because I'm usually controlled, despite living with all of these handicapped animals that I take care of, I was really kind of surprised. It took me a delayed response to realize, oh gosh, this is an asthma attack again. Uh,
Yes, yes.
I do use air purifiers in my house. They're pretty inexpensive now when you buy them on, the major mail order thing. And because I have birds, cats, and dogs, all fantastic triggers. And it's funny thing is, my animals, I think, are allergic to humans because a lot of them are on allergy pills, the same ones that. Now, not all human allergy pills work for animals. They're not all safe. But
Aha, affects animals too.
well, it
Yeah,
does. You really have to keep the dust controlled in your house, and keep their feather
yeah.
dander away from them. Just like I got to keep my dust around. That's why I have the air purifiers. But one of the things, with all the insurance challenges and everything we have, they're making. I think I don't have the statistics. That's your field, but I would be curious to see when you mention the numbers, where we fall in behind diabetes. Diabetes is a good moneymaker for the pharmaceutical companies, and I'm not saying it shouldn't be. Those you can't just not do it, so you don't support the pharmaceutical companies. But
Mhm.
it shows that if we don't get this under control, it is very costly to our economy. Um, but when I was growing up, we didn't have things like nebulizer machines, mask over your face, like that. My mother used to put me in the bathroom and shut the door and run the shower for until the
Mhm.
cold water ran out, and make me breathe. My mother was uh, I think she depended on a certain chest rub that we all know about, still in market, so I won't mention its name, but as a kid, you hated the smell of it and everything else. But I remember having an episode as an adult in college and sending my husband to the store saying, all right, go buy it. I can't stand it, but it worked when I was a kid, and I had to laugh afterwards because it worked. then I was wondering, did it really work, or was it my loving mother's attention that I was getting when I was having these episodes? Sometimes fond memories are like Aunt Mary's apple pie at Thanksgiving when she's no longer there. The pie really wasn't that good. You discover when she's gone. You just enjoyed the family, uh,
Right.
interaction and things. But nebulizers now, which you usually need a prescription for or be prepared to spend 60 to up to 200, you can actually get little portable rechargeable nebulizers.
Mhm.
They're available online. This one costs less than $15. It plugs in, the charge lasts a long time. You just push the button and it works. I don't have any medicine in there right now, but they're very simple to work, and because they're so inexpensive, you could actually keep one in your glove compartment with some medicine available, which is only prescription. There is a couple over-the-counter products for inhalers for people that don't have availability to get a doctor's prescription or can't afford the medicine. It's certainly better than nothing, but because this is a chronic problem, at some point you need to figure out how to get a doctor to assess your situation.
Just
Uh,
keep in mind though, if you're keeping that in the glove box, you got to be careful of what temperature it is outside and how hot it gets in your car. But
right, but there's no medicine in it. That would be just the
oh right, I
machine.
see.
Yeah.
Yeah.
Medicine you keep like a diabetic keeps in their pocketbook, with things that they need.
Hmm.
Um, the inhalers, and so many of these, just like the blood pressure drugs or combination drugs now, pharmaceuticals have discovered that, you have two good drugs, mix them together, and they're twice as good and twice as expensive. Not
Hmm.
all insurance cover the combination drugs, but there are websites that do give a pretty decent price. And some of the medications you can trust. I think pretty much what you can order from someplace like Canada. Canada, pharma.com has, but they don't do anything that involves any diabetic and any insulin products for obvious reasons, liability, and they don't do any of the narcotic pain things. But your traditional drugs that sometimes are too expensive, you can save money that way. Oftentimes during high episodes, your doctor puts you on steroids. So if you have an episode later and you had some steroids left over, or somebody offered you steroids that they didn't take, it's not good to self-medicate you with steroids.
Right.
Steroids not done under physician's attention can lead to kidney failure, hypertensive crises, lead to a situation where when you really need this medicine, even IV in a critical situation, it won't be effective for you. So, if you have a chronic medical condition, you should have at least a primary physician that all your records are in one place and they're not reinventing the wheel. They know what works for you and what doesn't.
Right. And keep in mind if you're watching the show, we don't mean you have to have a physician. That's your just your decision. But you need a medical professional. I mean, nurse practitioners can be pretty good, and chiropractors or whoever you choose. That's up to you. But we're just saying if there's something dealing uh, a delicate situation like asthma, you may want to have a physician in this type of situation because it can mean life or death. So,
Well,
by the way, though, I get a lot of mucus when I get that chronic inflammation in my bronchial tubes. I get a lot of mucus that I bring up, and it gets really bad sometimes. That's
thank you
one
for
of
sharing the gross comment,
yeah.
Gloria, but I had to
Well,
add
that's
that
what I
as a
was
nurse.
asking you. Do you get a lot of
But
mucus?
that
Do you get
leads me
airway
back to
swelling?
my everlasting push for hydration. When somebody
There
has
we go.
lots of mucus, one of the things you can do to reduce that mucus,
Hmm.
as long as you don't have any heart conditions, so you can't drink a lot of water, hydration is the quickest way to get that mucus thin enough to swallow it properly. Um, and milk products, dairy products usually are not. They create more mucus. If you're
Right.
already
Right.
having a flare up, you want to avoid the dairy things. Another common test when you go to physicians, and it's now over the counter, is a peak flow meter, so that you can actually measure the strength of your breathing, how effective your breathing is.
Hmm.
This is really pretty expensive when you buy the generic brand at any of the major drugstores, or I'm sure it's available inexpensively too online. Um, and it's not a replacement for your doctor, but it's certainly, if you're having early warning signs and you know that when you're healthy, you have a certain number and now you're struggling to get half of that. Um,
You know,
And
in the fourth quarter, I'm going to give a lot of tips about what you can do to help with the beginning of an asthma attack. Then it can actually help to relieve some of that stress. And then if that one thing doesn't work, you go to the next level. If one thing, the next doesn't work, you go to the next level. And a lot of times something simple can work, and it's not only the medications. So, well, I'll talk to you what I do. I'll talk about the herbals that I take too, and as a precautionary measure, and what I have for emergency situations.
and
So,
I know a lot of holistic things, acupuncture and other things that also are helpful. But when you say if one thing doesn't work, try the next thing. If you're in the middle of, uh, you know, an asthma attack that's, going quickly and it comes on suddenly, you don't have time to actually try different things. So you should have a plan to know what works for you the quickest.
right. So, if you want to have things checked in your blood, for blood tests, your doctor can check for mast cells, eosinophils, T helper 2 cells, immunoglobulin, IgE, histamines, leukotrienes, cytokines. There's different blood tests that need to be done or should be done if you have asthma. It's just even to touch base and see if have they gotten worse, have they gotten better, so keep it in mind. Triggers, we did talk about a few triggers already. I'm going to add to that dust mites, mold. Peggy mentioned animal dander, pollens, yes, of course, smoke, yes, of course, air pollution, yes. If you have a wildfire smoke situation in your area, realize you may need to stay in, because you can't be out with that. It may trigger an asthma attack, and like I said, it can be um, asthma can be fatal if not treated. So we need to be careful about that. So other things that may contribute to asthma attacks or trigger them are viral infections, the flu virus, any respiratory virus, um, things that can uh, also trigger in other areas are exercise, cold air, stress, strong fragrances. I cannot be around a lot of perfumes because there's a certain base that a lot of perfumes use that I can't be near. I need to have natural oils in anything I use. So cleaners as well that you use in your house. I only basically base all my cleaners on vinegar, hydrogen peroxide, and I don't use ammonia and bleach anymore unless absolutely necessary, and then I'll spray sometimes in my sink to bleach out the stains, but that's about the extent of it. But most
But
of
it
the
should
things,
always be diluted and never mix with any other
yeah,
professional cleaning products.
yeah. Oh, definitely. Bleach needs to be diluted. Where peroxide, you can just spray it on the countertop even and wipe your counter and things of that nature. Excuse me. So other things that can trigger asthma is flour. If you're going to bake, or baby powder, big one, huge one. I will never wanted baby powder in my house because it was dangerous even for the babies. They pick it up, they inhale it, they can die. It's not good. There were deaths a lot in the 1980s from baby powder, believe it or not. Wood dust, sawwood, paint fumes, agricultural chemicals, industrial things. So, Peggy, do you want to go through some of the medical treatments that are done in segment 5 there?
Sure. The first thing they do is your basic chest X-ray. That not normally just to see I'm your doctor. This is what we're doing today. But if you're showing signs of possible, um, flare-ups, I guess exacerbations they call it.
Oh, I'm sorry. We are going to have to take a commercial
Oh,
break, but we'll
okay,
be
we'll
right
start.
back. The nurse Peggy, so she can finish
Okay.
what she was talking about. Be back
No,
right back.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom. purpose, passion, power, and peace, all quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren. And Nurse Peggy, I'm so sorry to interrupt you, but please, continue with medical treatments.
Well, it's really important that all of us, once you get to a certain age, especially if you've had a healthy childhood, we should all know our medical histories. We should have it. Many people are now putting it on their smartphones, but it's a good idea to have a copy of it on your refrigerator, believe it or not, in case paramedics come and you accidentally dropped your smartphone in the toilet or something. You need to know really. Because it saves a lot of actually money because you're not going through unnecessary things, as they're guessing. And as a healthcare provider, I would say that yesterday, me ending up in the ER probably didn't have to happen. I had warning signs, and I had a good rational excuse why. I was just having white coat syndrome or something where you think you have everything, in nursing school. We all go through that. We're going through school. But a doctor knows how to do a good lung exam. They tell you, they listen to your bases because they can see if you have dead space there. If you're not getting clear perfusion of air, and part of that is also having good blood flow. So all of these systems are related to each other. Uh, as they're listening to the different sides of your lungs and they tap, if they hear thuds and dead noise, that's not a good sign for them, but it's a good sign that there's still things you can do. As you talked about, I think, Laura, I think you mentioned the alveoli, the little fingers in the lungs that have to just move slowly. Well, with chronic lung diseases, they get stiffer and stiffer. They don't move. The air doesn't pass through as easily, and that's why we struggle when we have this. I actually, being an ICU nurse experience, I have a fancy stethoscope that actually has a lung on it that I can listen to cardiac, or I can listen to heart, or I can listen to lungs. And it actually takes me through each thing. And I can watch on my phone and hear what I'm hearing amplified, because as I get older, sometimes your hearing doesn't work as well. And even when I was seeing the numbers that I didn't like, I still continued to, say, okay, calm down. Stress is why you have this. You've got a lot of stress. Even if stress is why you're having these episodes, you still need to get medical treatment, because things did go very fast. I wasn't, I got to the point where, am I calling 911, or I don't want to go to the local closest hospital, or, who can I call to get me where I can get the treatment where my doctors are? One of the tests they do is a forced vital capacity, where they want it. Usually when you're doing that test, it makes you cough and gag and everything else, because you're trying to take that deep breath, and he's measuring the numbers. And of course, you want to ace the test, like the cognitive test someone takes, and you can't, because he wants to hear you gagging and coughing, because he knows when you're struggling. There's ratios, the blood tests that Gloria talked about. the peak flow testing, one thing good about having that available to people at home is that you can kind of challenge yourself at home, just like when you're exercising on the treadmill or whatever every day. You can actually notice your numbers, keep track of it, and do that test at home. It's inexpensive to own the device. Um, if you know certain foods trigger, like I used to be anaphylactically, which means that anaphylactic is when you stop breathing when you have an emergency trigger like that. Some people can be that way with bee stings. They can be that way with eggs. Uh, I was with a patient yesterday who's allergic anaphylactically to watermelon. I thought, oh, you poor guy in this hot summer, I love my watermelon. But anything, and even some of the most benign things for certain people that are very sensitive, uh, it's a trigger. And if you have mild reactions as an adult, sometimes we tend to say, well, it's not that bad. I really want to try this. You do that a whole bunch of times over months and years, you're building up a higher resistance to tolerating it. You're not even building your tolerance to the thing you're allergic to. You're putting yourself at higher risk for an anaphylactic reaction. The skin prick testing that a lot of allergists tell you, they don't do it as much now because I think they have more sophisticated tests. But a lot of people even avoid that because they don't want to be told they have to give up their cat or dog. I'm not willing to give up my pets, but I know I have to keep my asthma in check so that I don't have episodes. Uh, we're going through a heat wave right now, not as bad as some of parts of the country. Gloria, I think yours already started. Um, Extreme temperatures, doesn't matter how well controlled, it's going to take its toll. You're not going to go out and cut the grass. You may not cut the grass at all if you're sensitive to grass. You've got nothing to prove. A lot of times the men don't want to admit that the hay fever is getting them down. They're going to be a man no matter what. They have a heart attack. They're going to go shovel the snow anyway.
How
Sometimes
true.
and that's just human nature. But you've got nothing to prove, and I had an experience in the ER where some of the tests that were abnormal, I had a very young physician's assistant who kept saying, well, this isn't normal, but look how old you are. I'm sorry, I'm not that old. I'm not even 70 yet.
Yeah.
The year. And, but that's frustrating for people in
Mhm.
our age. There's a larger population of people in our age. And, the younger doctors need to grow up knowing that you just don't write us off. Got a very good friend who's 99 and still, actually, my uncle is 99 and still, functioning and having a productive life. But as I've said in other shows, it's your responsibility to manage uh, any illnesses, any medical conditions you have. It's not the doctor's fault if he orders the wrong insulin because you didn't tell him what your sugars were or you weren't monitoring your sugars. If you know that certain things are causing problems, the day before I had this episode, I was in two homes that didn't have air conditioning, no fault of their own, just reality. And I had to go up 35 stairs up and down very narrow stairways with no air conditioning. So by the time it took a toll, I still could have taken a break, rested, had more hydration, made sure I had my asthma medicines that, help control it. But no, I just, like the ever ready bunny, kept going and the batteries ran
Mhm.
out. Um,
Yeah.
Gloria, uh, what do you think about? I mean, your family too has some sensitivities and stuff, and do you
Yeah, I
find it
think I'm the worst. Yeah. As far as sensitivities, my personal experience is that when I am in fight or flight, which is very frequently with me, um, that's when I have my problems. It drives down the pH level to me at about 6.0. And then I react to everything. So what if I keep my pH level up to at least 6.6, I don't have those problems. So if I'm having extra problems with my asthma one week, I'll check my pH level. And sure enough, okay, yes, I verify it. And then I will bring my pH level up. I use different things like certain vegetables and little baking soda. If I drink coffee or anything acidic, I put just a pinch of baking soda in every cup. It helps. It helps. Little things that can help at home. But everyone else in the family, I think my one brother gets a rash quite often from different soap, sodium lauryl sulfate and things like that. I know I shouldn't use sodium lauryl sulfate either, but I do. But he is sensitive with his skin. I don't think any of the others are sensitive. So, but we were the blonde ones. Let me explain that. So we came from one side of the family, and the others came from the other side of the family who they don't have allergies
So,
like
Gloria,
that.
speaking of the epidemiologist, and I don't know the answer to this, and just popped into my
Hmm.
head. How do they identify like genetic propensities,
They'll
in the
do a
study?
genetic test for the best thing to do is you can check genetically, like say your father had severe allergies and asthma and he died of asthma or something. They can do a genetic test to see if you have that gene that can lead more easily to asthma. And if you have that gene, then they can watch you more closely.
And you
Um,
can also monitor how your house is purified, and you can get
right. I
all
sell
air
air
purified,
Right. I
right?
sell air purifiers for 20 bucks and they're the real good expensive ones, and I have several in my house and it's interesting because now that I have air purifiers, when I walk outside, I can smell a slight pollutions in the air that I couldn't smell before. It's like when I was living in Chicago, never noticed anything and everyone's like, "How can you live there? The air is so dirty." And I'm like, "I don't think so." And then when I moved, you take a person out of that situation and then they can recognize it more easily.
Well, my husband and I had been in college in rural Alabama, and we drove across country to go to school in the LA
Mhm.
basin. And as we're at the top of the basin, we couldn't see anything below, couldn't see buildings, couldn't see anything but the smog. And we almost turned around and went back because we thought, "Are we going to go through that? What happens on the other side of it?" Um,
Right, right.
there's so your life can be easier. It's not like, oh, poor me, I'm born this way, I can't do anything. You can do anything to
Yeah.
manage the things that stress. And aside
Hmm.
from traditional medicine, I mean, things like chakra-based techniques and acupuncture, they actually clear your chakras. They help you, the parts of your body that are innate towards inflammation and things.
Yeah.
I actually using an energy medicine technique called neuromodulation technique. I was able to reprogram my autonomic nervous system not to react to shrimp. So I don't stop breathing now if I walk in somebody's house and they're cooking shrimp. Um, but it's always important to have some medical professional actually diagnose you properly to make sure your
Right,
reactions aren't related to something more serious in your body. And there's no way we don't have that Star Trek recorder that they scan your body yet, um,
right.
and tell you everything that's wrong.
And here
And
in
we were young, Gloria. There was a
Mhm.
big thing in the news: the boy who lived in a bubble in Texas.
Yeah.
What we know now is, and I had a dog that was just like that boy around that time. He
Mhm.
only lived a short life because he had no autoimmune system. There's a lot of infusions like immune globulin that people get once a month to build up their immune systems. There's other medications out there that either allergists, immunologists, or just the specialists, even neurologists, sometimes if your immune problem is related to something neurological, that prescribe these medications. And for some it used to be infusions. Now you can even do them sub-Q, which means just a simple shot in your abdomen. um, and that's not just the typical allergy type things. Crohn's disease has, arthritis, all of the autoimmune type situations. Has
Yeah.
really great medication out there to manage the symptoms, but it doesn't relieve you of the responsibility of trying to not bring on more symptoms. Dare your body.
Mhm.
How far can you go?
I just wanted to make one point and then we're going to take another commercial break. Rescue inhalers are the portable little ones that you hold.
Right.
Nebulizers is the electric battery powered machine that converts liquid medicine into fine mist that you inhale with a mask. So there's two different ones with that. So when we come back, we'll explore asthma solutions. What does the science actually say? Stay right there. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Welcome back to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren. By the way, Nurse Peggy had to leave, and thank you very much, Nurse Peggy. I was very happy to have you on my show. Let's talk a little bit about complementary lifestyle approaches. So there's different things that you can do on your own to increase your lung capacity, to maybe hinder or ward off an asthma infection. So the evidence is, this is only evidence-supported approaches here that I'm going to tell you. Breathing exercises, deep breathing, breathing in all the way, stretch your lungs out just a little more, hold it to the count of 5, and then slowly breathe out, count to like 6, breathing out. And diaphragmatic breathing, that means, inhale a little, put your lungs out, and then only use your diaphragm to inhale and exhale. Use those bottom muscles. It actually strengthens them so your lungs can enlarge even further. Pursed lip breathing. I think we do that a little. It used to do that with Lamaze. Pulmonary rehabilitation. Obviously, you can go for rehabilitation for that type of thing to increase your lung capacity. Physical activity, heavy weights, sleep quality. Watch how you sleep, when you go to sleep, when you turn off all your blue light objects, your computer, your phone. Don't sleep with them nearby either. Stress reduction and mindfulness. Yoga, I'm a big believer in yoga. Herbal therapies, ginger, turmeric, boswellia, butterbur, black seed oil. My big one, my go-to is, I'll tell you about that in a minute. So never discontinue prescribed asthma medications, no matter what you do. Always consult with your healthcare provider and make sure that you guys agree on what you're doing and you do what you agree on. If you add something to your medical care plan, please let them know what you add. It's very important you let them know what you add. So always let your healthcare practitioner know what supplements you're taking as well. I take B complex, take a few others. I take zinc when I think I'm getting sick. So that's important. So the future of asthma care holds many different things. Personalized medicine devices that tailor asthma treatment to your personal unique genetics, lifestyle, history, genetic risk assessment. That's what we had mentioned earlier. Yeah, definitely. It can be a big help in the future yet to come. Artificial intelligence prediction models also, analyzing large amount of health data, predict asthma attacks, and help identify triggers. Very important. One positive effect of AI that we wanted to mention here. Wearable respiratory monitors. Interesting, huh? Continuously track breathing patterns and lung function. Smart inhalers record when medications are used and remind patients to take their prescribed doses if you're on a dose scenario. Digital health monitoring. Sometimes you have those smart watches. It could be great. Maybe you can get one that measures your blood oxygen level. When it starts to drop, you may start to think and analyze yourself for your asthma. Biologic therapies, specialized medications target immune system proteins responsible for causing it. And precision immunology studies person's unique immune system to identify exactly which inflammatory pathways are causing the asthma, allowing for more targeted and effective treatments. So let's look at, it's just letting you know, we went into early diagnosis, improves outcomes, most asthma is highly treatable, know your triggers, follow the asthma action plan, support lung health through nutrition, exercise, and emotional awareness, seek emergency care for severe symptoms, don't play around, go to the emergency room. I've known a person to die of asthma and they didn't know what to do around them. So please keep track of yourself, be self-sustainable. Every breath is a gift. By understanding asthma, recognizing its triggers, and working with your healthcare team, you can take meaningful steps towards protecting your lungs and improving your quality of life. There, but for the grace of God go I, and may your breath of life improve. God bless. See you next time.
This has been Medical Intuitive Insights with host Dr. Gloria Warren. Tune in each week as Gloria shares over 40 years of experience and yearns to provide knowledge derived from intuition and research. Wednesdays, 2 p.m. Eastern.